members, I recognize the presence of the Minister of
Statistics on alcohol consumption in Uganda provided that 42.8% of Ugandans aged 15 years and above are alcohol users. According to the Minister Muhanga, Uganda is at a high health risk of alcohol-related illness with these numbers.
Look at what families we are raising with alcohol. You really can't say pastors drink. I mean, pastors have been in accidents, they drink. That's an isolated case. If we are telling you that 90% of the people who show up in Mulago at our emergency are drunken drivers. So a pastor, it will be just an accident caused actually by a drunken driver. That's how they will knock a pastor. That pastors are fighting in their homes, reverends and fathers. I have never been to a police and found a father or a reverend or a pastor who has fought. I have never.
How much can an individual consume that alcohol when it is being, because if you want to enforce, it is very difficult. I saw it, I've seen it, and even if we come up with a new alcohol bill as it is being proposed, we are making the commodity very precious. The more we regulate, the more the precious the commodity becomes, the more people tend to consume because they know there's something good in it.
The total annual per capita alcohol consumption among Ugandans aged 15 years and older is 12.21 litres and 4.8 litres in the African region.
Are you proud, honorable members, that we are the leading alcohol consumers in Africa? And we are the third in the world. We consume more alcohol than anyone, and we are called a third world country. Drawing from the statistics above, we can state that there is no safe level of alcohol. Alcohol consumed in any amount contributes to negative health outcomes, and this assertion shall be clear to all. We also want to reiterate that alcohol is associated with negative social and economic outcomes to not only the users, but also the societies and communities where they live.
It was also noted that high alcohol consumption greatly contributed to lower academic performance among students of higher institutions of learning.
Let's protect the brain. And that's our proposal, and we have a technical explanation for it. Because of the brain, which is still growing in these children, let them not drink alcohol. If they start alcohol at 18, a good proportion will have their brains affected, and that's going to affect them, and there is scientific evidence for that.
There are studies that has been done, and they indicated that alcohol consumption has a negative effect on the academic performance of students, as it can make it difficult for them to manage their academic responsibilities and their social life as well, and this leads to a high risk of dropout or failure and repetition of classes.
The 2014 nationwide STEPS Non-Communicable Diseases Risk Factor Survey revealed that 28.9% of adults between 18 and 69 years of age consume alcohol, a figure that increased to 31.1% in 2023. Mariona Wari and Namfuka Farida for UBC.
Honorable Francis, see the Minister.